American Heart Month, and tonight a new study links pregnancy complications with heart disease. We'll explain in a few moments, but first, two major hospitals tonight announcing a new partnership to improve access to care for cancer patients in central Brooklyn. Yeah, cheers today for that new partnership that promises to increase equity and access for cancer patients. Joining us now to talk about it is Dr. Kevin Becker. He's the chief of the Division of Hematology-Oncology at Maimonides Medical Center, and Dr. Mauro Salifu is the chief of the Division of Nephrology at SUNY Downstate Health Sciences University. Dr. Becker, Dr. Salifu, that was a mouthful. Thank you both for being here. So congratulations on this new collaboration. And Dr. Becker, I want to start with you. So explain how this partnership is going to help residents in central Brooklyn, especially cancer patients, because this is a largely underserved community, and many of them, by the time they are diagnosed with cancer, it's advanced, sometimes too late. Yes?
You're absolutely right, Cheryl. So this is really about two institutions rooted in Brooklyn partnering in the fight against cancer. We know that Brooklyn residents are underserved when it comes to cancer. In 2004, when Maimonides established the Cancer Center, it was the only one in Brooklyn, in a borough of 2.7 million.
Yeah.
We can count a half a dozen in Manhattan with a million less residents. So this is the two institutions coming together, building on each other's strengths to be better as a whole for the population of Brooklyn. And I'm really excited to work with Dr. Salifu.
So many people are excited, as we saw from the footage there. And Dr. Salifu, this partnership is also about early intervention. Please explain.
Yes, this partnership is really very important for SUNY Downstate, for the people of Brooklyn, and for Maimonides Hospital. Early intervention and diagnosis, screening, early diagnosis, early treatment is the only way to beat cancer.
Right.
And the only way right now in Brooklyn to be able to manage cancer by an institution is collaboration. There is no one hospital that can provide all the resources for cancer patients. So by coming together, we're bringing the strength of each of the institutions for the patients. So anyone in Brooklyn right now listening, know that now you have a home for cancer care in Brooklyn.
Yes, that's good. You talk to the camera. Very good. So, Dr. Becker, talk to us about the immigrant population. They have unique needs. There are issues with translation that make them unique, and that sometimes causes them to fall behind in their care. Yeah. Talk to us about how that's going to be resolved.
Yeah, and that's why it's so important that we're taking two Brooklyn-based institutions. Both of our institutions have been there for more than a century. We're familiar with our communities. We know those barriers to access, challenges in trusting healthcare providers. This is what we've been doing. I've been at Maimonides for 13 years. I know Dr. Salifu's been at Downstate longer than that. So we've been working with these issues day in and day out. So we're really the best equipped to work together to address these. We've got all the resources that we need at Maimonides. We're going to bring a lot of the strengths that we've had at Maimonides and rely on a lot of the strengths from Downstate to make sure that all of our populations benefit.
This is truly a win-win. And Dr. Salifu, talk to us about the kind of cancers that will be treated through this partnership.
Yes, so for the most part, we have, the commonest cancers in central Brooklyn are the colon cancers, the breast cancers, the lung cancers, and a few of the pancreatic cancer. Those are the common ones. But we also have other issues like sickle cell that we want to address along the line with this partnership. Sickle cell is very prevalent. SUNY Downstate is a premier academic research center. So we want to bring that strength to this partnership to see what is the best models of care for these patients in Brooklyn.
Yeah, shout out to Dr. Riley and his leadership at SUNY Downstate. And I want to end with you, Dr. Becker. So when I was researching and listening to the press conference, I was happy to hear that this is going to happen immediately, not down the line, not months from now, but right now, correct?
Yeah, so the exciting thing right now, we'll be able to have a patient seen at either of our institutions, have their case presented at a multidisciplinary tumor board where we've got over 60 cancer physicians able to add their input and expertise and make sure that patients are really getting the best plans possible, a multidisciplinary plan for their care.
This marks a new era, this collaboration. I want to thank you both, Dr. Kevin Becker of Maimonides Medical Center and Dr. Mauro Salifu of SUNY Downstate. Appreciate you guys coming in tonight. Yeah.
Thank you for
Thank
having
you.
us.
Yeah.
Thank you for having
We're
us.
usually all alone here. So
Okay. We
thank
have
you.
company.
Yeah, we had some company tonight. Appreciate you. And that leads us to tonight's Daily Dose. You know, February is American Heart Month, and a new study suggests that pregnancy complications